Hello, everybody. Dr. Collins Harrell here to explain a little bit about dental monitoring. We're excited that you've joined and are interested in learning about dental monitoring. The orthodontic world has been really excited about dental monitoring for some time now because it just revolutionizes the way that you practice ortho. It's better for the patient, better for the team and the practice. But up until now, it's been too expensive and difficult for the general dentist to use this technology. But now with our new partnership between Progressive and Dental Monitoring, we're super excited to bring this technology to our Progressive doctors. So how does dental monitoring work? Basically, if you're unfamiliar with this technology, it's using the fact that each one of our patients is walking around with a supercomputer in their pocket, and that is their mobile device. So it's using the technology in a mobile device combined with a scan box. So when the patient signs up for dental monitoring, you will give them a scan box, which is basically just something that holds their phone and keeps it a fixed distance from their mouth so that the scan from one scan to the next scan stays consistent. And the first scan will be done in your office, kind of a baseline scan, so they can learn how to use the scanner, make sure they're doing it right there in your office with your team. And then follow-up scans will be done by the patient at home or wherever they want to do it conveniently. So the patient scans their mouth using an app that they download onto their phone every 2 weeks for aligners, or say every week for aligners and every 2 weeks for brackets. And then what happens with that scan? The scan then gets uploaded to the dental monitoring AI, the artificial intelligence that crops all the photos. The AI runs through the photos and scans for potential flags or issues. It then brings those issues to the awareness of the Progressive concierge, which we'll talk about in a little bit. But the concierge is a service that's provided through Progressive Orthodontics. It's what allows us to bring dental monitoring to you at a price and in a way that is convenient for the general dentist. So normally in an orthodontic office, you would have a staff member who's trained to do everything that needs to be done in dental monitoring. But if you are only doing a couple cases a month, it just doesn't make sense to have one staff member who's in charge of and trained to do that. And so part of what makes this good for the general dentist is that we're providing a concierge service that will review the information from the AI and communicate with the patient on simple things according to a decision tree, which is a document that's included later on in the training. But basically just says, if you see this, then do this. If you see this, then do this. And then the concierge will decide when to notify you in your office if there's an issue that needs you to bring the patient in. And so why this is great is because now the patient doesn't have to come into your office for the nothing to do visits, for the visits that you're just looking to make sure everything is going well. And they only need to come into the office when there's something that needs to be done for treatment to progress. And when they do come in, you're not having to take the time to get caught up on the case and figure out what's going on and look and decide what needs to be done. That's all been done ahead of time, so when the patient does come in, it's much more effective because you already have a plan. You know exactly what needs to be done at that visit. So with aligners, basically, there's not a lot. I mean, the patient has to come into the office initially to get the attachments put on the teeth. The patient has to come in if we need to put on a button or give them rubber bands, I guess, or to do some IPR on the teeth. But for the most part, if everything's going well in an aligner case and the patient is wearing the aligners well and the setup has been done well, hopefully using Progressive aligners and getting great setups, then really there's not a need for the patient to come into the practice except just to check to make sure that the teeth are following the aligner and to continue to encourage the patient. But if artificial intelligence or this virtual assistant can do that for you, that saves the patient having to get their child out of school or take time off of work and come into your practice. And it saves you having to spend the time and money of your front office staff answering the phones, scheduling appointments, setting up rooms, bringing the patient in, having you come in and see the patient or talk to the patient. cleaning up the room, all of the things that are involved with the costs of an office visit, where there was really nothing to do. You just looked and said, oh, everything's tracking great, good job, continue on. And so that's what dental monitoring is able to do for your patients, is from home, from whether they're traveling, wherever they are, every week when they scan, the artificial intelligence is able to say, yes, you look good, go ahead on to the next aligner, or there's a problem, you need to stay in this aligner, you need to use Chewies before you can go to the next aligner. And so it's really awesome because it's encouraging the patient to wear the aligners, to get the result from each aligner before they move on to the next one, so that their teeth continue tracking well. And we'll talk a little bit more about that as we go through this little training here. But that's the magic and the beauty of it, is not only is it saving you time and money, making your treatment more cost effective, it's saving the patient the hassle of having to come into the practice when they really wasn't a need to, but it's also encouraging better treatment outcomes because the patient is being monitored, and rather than following just a set schedule of, oh, you change your aligner every 7 days or every 10 days or every 14 days, you change the aligner when that aligner has fully expressed its movements onto the teeth and the teeth have followed. That's the ideal time. It could be 7 days, it could be 10, it could be 14. Depends on that patient, depends on the movement. And so really, we don't want to move to the next aligner until that movement that's been prescribed for that particular stage has all been accomplished. Okay, so what about with brackets? With brackets, usually there's things to do at the appointments, but sometimes, especially during the initial leveling and aligning, when we're on round NITI, sometimes we bring them in too often and we end up messing around when all we really needed to do was just let time go by. But we're checking to make sure they don't have any brackets that have come off. We're checking to make sure there isn't a arch wire that's broken. If you've done enough braces, you've seen arch wires broken or pulled out, or you see an area where they're having hygiene problems. There's things that we're looking for, scanning for when the patient comes in. And so those are the things that the monitoring is able to do for you with brackets. Okay, so more efficient treatment because you can be notified when the teeth are no longer moving, when the wires become passive, so that okay, well, up until now, no brackets have come off, no ligature ties have come off, the arch wire hasn't broken, there hasn't been any hygiene or emergency problems, so you've been monitored remotely, and they only need to come in when it's time to put in the next wire. Okay, or you're able to see that the wires stop moving and the teeth still aren't perfectly straight as far as rotations, and you want to bring them back in and maybe reposition a bracket or try to tie tighter to a certain bracket to get the rotations fixed. But at least when the teeth have stopped moving. If they're still moving, you might as well let treatment continue. So it eliminates the nothing to do appointments. Okay, and it only recalls the patients when there's actually something that needs to be done. And again, when they come in, you know what needs to be done. You already have a plan laid out because you've been monitoring remotely. And so when they come in, you can be all set up and ready to go for what needs to be done at that appointment. So more productive treatment appointments. Okay, with aligners, again, better patient compliance because the scans are telling them whether they can move to the next aligner or not. Potentially, you could see the patient every 6 months. If there's nothing that needs to be done, you've given them all their aligners, and basically they're in charge of their treatment as long as they're getting their teeth to move and the AI is saying that everything's moving and they can just continue on. It's really more convenient for the patient and better for you. So really a big practice differentiator, right? So for the practice, it delivers better patient experience. They still feel like you're seeing them all the time. You're communicating through the app. There's an app for the office. There's an app for the patient. So if they message, anything they want to tell you, any questions they have will come to your team. The concierge will pass that on to you so that your team knows that they need to respond to that. They know that you're looking at their scans. They know that the computer is looking at their scans. And so they feel like they're being well taken care of and getting, care that is high quality but also convenient for them. I feel like that's where we're moving in the world, is everybody wants to do, it's like with Amazon. I don't want to go to the store if I can just pull out my phone and buy what I need and it's going to be at my doorstep tomorrow. And so it's kind of the same thing with delivering orthodontic care. If they don't need to take the time out of their life to come into our practice, they would prefer not to, and to be able to just pull their phone out and be able to have the virtual visit at their convenience whenever they want to do it is a good experience for them. It improves our efficiency and profitability because we can potentially see more orthodontic cases or be freed up to do other kinds of dentistry. Optimizes appointment scheduling because we know what we're doing when they come in. Improves the patient compliance because they know that they're being monitored and observed. Provides proactive treatment monitoring. Enriches the client experience with the office. Enables more and better communication. Fewer unexpected appointments. Now, this is for sure true with brackets as well. Just fewer coming in thinking that you're just going to do a quick wire change or a quick retie, and you find out that there's 3 brackets off. There's just things you didn't know about, and that ends up eating into your productivity that day. For the patient, it's less time away from work and school and other activities. It's fewer missed or rescheduled appointments because they know that when they have an appointment, it's important. They don't have very many of them because most of it's done remotely. Feeling supported by your practice, convenience for them, patient accountability. I think this one's huge, and we'll talk more about that in a minute. And then just constant communication and connection to the practice. So let's talk for a minute about some of the things that are observed. Like, what is the AI actually looking for? What is it able to detect? And then what do we do with that information? Okay, so the AI is looking for over 130 different oral observations, which I've kind of summarized here, but it's pretty involved. So under aligners, the things that we can track are whether or not the teeth are tracking with the aligner. So it's able to basically look for the little gaps between the tooth and the aligner and notify us when the teeth are not tracking with the aligner. It can tell us if there's an attachment that has come off. If we're using some type of an auxiliary appliance, like a button, it can tell us if that button's been lost. It can tell if there's aligner damage. We will know by looking at it how many aligners are remaining, what number we're on. Okay, so with tracking, satisfactory tracking alignment, if there's a noticeable unseat, meaning the tooth is not seated into the aligner, that means it's not tracking, it will notify us. We can choose to continue and ignore that one tooth. Let's say there's a tooth that's not extruding, like maybe an upper lateral incisor, and we go, well, I'm going to ignore that one because I'm going to let everything else continue on because everything else is tracking great. It's just that one tooth. And when that tooth that's supposed to be extruding gets to the point where the aligner no longer wants to extrude it, but it's not, all the way down, I'll bring that patient in and put some buttons on and put an elastic to help get that tooth extruded into the aligner, but I'm going to wait until that movement is basically finished. So we can choose to turn off or ignore one particular tooth or unseat and continue on with the treatment. So attachment loss, debonding of an auxiliary like a button, aligner damage like a fractured aligner, a crack, or some shape or structural integrity problem. Or we can get triggered, say, hey, let us know when the patient is on aligner number 20 because I have to do IPR at number 22 and they need to schedule an appointment. So we can set it up so that we're alerted when the patient has moved on to a certain aligner because they might be moving at 7 days per aligner when they're doing their scan. If they get a green light every time that they scan at 7 days, they'll be moving quicker through their aligners than if the AI is telling them that they need to wait, and wear that aligner longer, use the chewies, and then scan again in 3 days. Then it could take them 10 days or it could take 14 days to get through a particular aligner. So we don't really know where the patient's at until either we get notified that a certain goal has been accomplished, or if we want to be notified when there's a certain number of aligners remaining or when they're on a certain aligner number. So we're able to track where they're at even though they're not coming into the office. Okay, so these are the types of things that we're able to see. Each time the patient scans, we can look at all of the different images. We can track what's happening. The computer AI is looking through all of these images and making determinations for us. And we're scanning every 7 days for aligners. Now with the brackets, there's a lot going on here, okay? It's able to monitor the appliance, the tooth movement, and also hygiene as well. So for example, under brackets, if there's a bracket that's debonding or has debonded, it will let us know. If a bracket looks damaged, bent, it will let us know. If there's an arch wire that has become disengaged in one of the brackets or is bent or distorted or fractured, or we can set a goal to let us know when the arch wires become passive so that we no longer see the arch wire moving. So, again, a lot of information here that the AI is looking for to help us in our treatment so we know what needs to be done when the patient comes in. It can tell us when there's a ligature tie that's been lost on a bracket, if the power chain that we've put on has become damaged or disengaged, if a spring that we're using is damaged. See over here, occlusal interferences, missed or damaged auxiliaries. If we're using something like a bite ramp, it can tell us whether that's become missing, even down to seeing TADs, if we're using TADs, buttons, if we put composite on it or for some type of a bite ramp on a molar, for example. All of these things, it's able to detect if there's been a change and something has gone missing or something looks like it's changed from a previous scan. Okay, so we get detailed records every 14 days from a patient who's doing brackets. For both fixed appliances and aligners, we're able to see and set goals for anterior-posterior relationships, such as the canine and molar classification. So we can say, tell me when there's canine class 1 on both sides, tell me when the molars are class 1. It can tell when there's space. So if we've done an extraction space, we can set a goal for, hey, the patient's going to go away and they're going to be using these springs that we've activated, and I think we're pretty close to the space being closed, but I don't want to see them until that space is closed. So we can have it tell us when the space has been closed. It can notify us when normal overjet has been achieved. So there's all these different things in the AP dimension that it can tell for us. In the transverse dimension, it can tell us when a midline deviation has been corrected, when a crossbite has been corrected. In the vertical dimension, it can tell us when normal overbite has been achieved. So we can set goals if we feel like, hey, everything is set up here to work well. I don't really need to see the patient until this particular goal of treatment has been achieved. Unless a bracket comes off or unless some other emergency comes up and that I can be notified of, and then I can look at the scans and pictures and decide whether that's important to bring them in or whether I want to wait until the next visit. So for example, here's a patient that is doing a rapid paddle expander. You could be doing this before an aligner case or you could be doing this with a bracket case. And this one you'd scan the patient every 7 days because there's very active treatment going on here with a rapid paddle expander. But normally in my practice, I bring the patient in after 1 week because I've had plenty of patients with a rapid bonded, paddle expander in, and the parents think that they're expanding, that they're turning the crank properly, but they're actually not doing it right. And then when I see the patient after a week, there's been zero change. And so I end up having to see the patient pretty frequently during this time because I don't want them to overexpand, but I also want to make sure that they actually are expanding. And so, you have this monitoring going on and you can see very clearly in the scans, yes, the patient is definitely getting expansion. I can see the expansion happening. The AI can actually notify me when the crossbite has been corrected so that we know we can stop. So it's very helpful in lots of different aspects of our treatment. Oral hygiene, again, both aligners and brackets, it will assess for gingivitis, for spots on the teeth, for potential cavities, calculus buildup. If we get calculus buildup on our appliances, it slows down the treatment. And so all of these things are conditions that the AI is able to detect and notify. And that goes first to the concierge. Sometimes it's handled through our concierge. Sometimes the concierge will notify you and you will have to deal with it through your office. These are some of the goals that can be set in our cases that it can track for us. Again, the anterior-posterior dimension, the canine and molar classification, closure of extraction spaces, or just maybe spaces that were existing in the case even without extraction. midline deviation or crossbite corrections, overbite corrections, and then just general passive arch wires. If we're maybe waiting, if you've ever been in a bracket case where I've done the initial leveling aligning, but I'm waiting for a primary tooth to come out, or I'm waiting for the eruption of a permanent tooth so that I can bond it and then include it in the case. I can basically turn the patient out and just say continue to scan every 14 days, and when the AI detects that that tooth is gone or that the tooth is erupted all the way, then it can notify me and I can bring the patient in. So this Hawthorne effect, this idea of being observed changes behavior, or when performance is being measured, performance improves, is one of the significant advantages to using dental monitoring in your practice, especially with aligners, where we really rely on the patient's cooperation, their compliance with wearing the aligners. And it's not like you're on a set protocol where every 7 days or every 10 or every 14 days they just change the aligner regardless of whether they did a good job wearing that aligner and complying or not. They know that the scan is going to be telling them whether they can change their next aligner. And it's observing, and it's looking, and it's measuring. And because of that, they behave differently. So behavior changes when people know that they're being observed and that their performance is being measured. But same thing with brackets. If you're at a spot where you need the patient to be wearing elastics and they know that the AI is scanning and looking for a change in their posterior, you can sit down and explain to them, now what these elastics are doing is it's moving your teeth into this class 1 position where all of your teeth are interdigitating properly. And every time you scan, I get a report as to how your teeth are lining up. And we have to continue to wear these elastics. It's going to be measuring and letting me know until you get to the point where your teeth have all interdigitated properly and we've got a class 1 occlusion. Then it's going to let me know that we can stop and go on to the next part of treatment. So these types of things where the patients know that they're being observed and monitored does change behavior and compliance. So this idea of aligner changes, it's called a go-live dynamic aligner change. This go, no-go concept. It's what we call when the patient is scanning their teeth with the aligners and the AI is giving them either a go or a no-go, either a green light or red light on their aligner. And so this is so helpful because that's what's getting compliance. That's what's helping these cases to come out better and speeding them along and reducing office visits, is because they're getting a green light or red light from the artificial intelligence, and they know whether everything's going great, or they know if they have to work on a certain area, or they know if they have to go into the practice to have something done to keep things moving along. So what does the patient see? They scan one day, the next day they'll get a message maybe that says, you're good, you can move on to the next aligner, or it will say, after reviewing your scan, the scanner or your doctor so-and-so advises to remain on the current aligner. And it's not that you've done this is just triggered by the AI. We can see that your aligners are not fitting properly. Biting down on chewies helps the aligners to fit more closely. Please remember, if you don't stick to 22 hours a day, your teeth may not be ready to change the next aligner. And so then they'll know that they need to scan again in 3 days, and they'll use their chewies. The concierge will point out where the aligner unseat is so that they can focus their chewies on that area. You could even take, if you want to get involved in it, you can take a picture of the area and send it to them with a little video explaining what needs to be done. But this is what the patient is seeing, is I can't move to the next aligner until this one is fitting properly and I get a green light from this app. What you're seeing on your end, in addition to the records, and you're able to see all of the scans that the patient's taking, is you can see when the patient is taking their scans. So if they're taking their scans every week like they're supposed to, and they're getting a green light to go ahead, it looks like these green circles. If they get to where there's a red square, that's a no-go. That's an area where it said you have to stay in your aligner. So here the patient said, I can't go to the next aligner. They scanned again 3 days later. I can't go to the next aligner. I scanned again 3 days later, and now finally I could move to the next aligner. Okay, so you can see where the patient had goes and where they had no-goes. And then a spot like this that's missing is probably an area where a revision, a refinement is done. So we get to an end of our aligner series, and then we order some revision aligners, and then we start again with scanning. So let's talk about for a minute, what is it that the concierge that we've set up, what are they doing versus what are you doing in your practice? So in your practice, when you start a new patient, and how would I talk to this on a new patient? You know, you could look at it one of two ways. You could look at it as, I want my patient to have a great experience. I want the treatment to go well. I want to differentiate myself. I want to save myself the time and the money of having the patient come in. And so I'm just going to include this. It costs, $300 if you're using progressive aligners or the progressive dental supply brackets. If you're using some other system, it'll be $375. That includes monitoring for the patient through the whole case, the concierge service, and the scan box for that patient. Okay, so only you know when you're going to create a patient, and I would talk to them either about, hey, we provide this service for you, and I just include that in my ortho fee, or you could offer it as an upgrade to your patient. So you say, hey, we're going to be doing this aligner treatment, or we're going to be doing this ortho treatment. With the aligners, I'm going to see you every 6 weeks in my practice, or every 4 weeks, or whatever you do in your practice. With the brackets, I'm going to see you every 4 weeks, every month. So go ahead up in the front and go ahead and make your appointments for the next 6 months. But we do have a service that we offer for an upgrade. And if you'd like to upgrade to this dental monitoring service, then you actually don't need to go schedule any appointments because we'll be able to do virtual visits with you, and we'll only have you come in when we see something that needs our attention. And so it'll limit the number of times you have to come into the practice. And then you have them pay that $300 for an upgrade service, so that they're buying convenience on their end. Or maybe you split the difference. Maybe you say, hey, I want to be able to provide this service for you. It's a $300 service. I charge my patients $150 for it because I really think it's a great way to do these cases. So I'm going to pay $150 of it for you. And that way, if they say no to it, they kind of feel like they're missing out on $150 that you were willing to pay for them to have something that's really going to help them. So that might be another way to look at it, is let's split the cost. But however you do it, I recommend that you try this on a couple of cases. The nice thing is that you are able to just buy one scan box at a time. You can just do one case. You don't have to invest up front for a big supply, a big inventory, or pay a bunch of money for education or getting set up in your practice. And that's the beauty of this partnership that we've been able to set up, so that this works for you, the GP. Okay, so when you have a patient then who, however you get to that point where the patient wants the service, whether you're paying for it or they're paying for it or you're both paying for it, when you get to that point, you're going to create the patient in dental monitoring in the app. And we have training videos from the dental monitoring trainers that's included in our IAT site that you can go and get the specifics, let your staff get trained specifically on how to do these things. But I just want to go over the overview for you of what's your responsibility in your practice, and then what is the concierge doing. And then the specifics of how to do that, you can get the training that's available for your staff so that they know the logistics of how this all works. But basically, you're going to be the one who's creating the patient in dental monitoring, and then you're going to start the dental monitoring at the appointment when you deliver either the appliance or when you deliver the scan box and you want to start the monitoring. So you're basically initiating it in your practice. And once you initiate it, the concierge will then start receiving the scans whenever the patient starts scanning. So what is the concierge doing? Incidentally, here it says all actions required and communications will happen via the to-do list in dental monitoring. So your team will have, or you and your team will have the app on your phone, and you'll have like a to-do list. And so you'll see things from the concierge that's asking you to do things if you need to call a patient or schedule an appointment. Or if they need to, they'll send an email to you, okay? But the concierge is looking at the dashboard every day. This is what a trained office person would have done, but we're having a concierge do it for you, included in the service that you're paying for. Okay, the concierge will be checking the dashboard every day to review all the notifications from the AI. The concierge will escalate any patients whose treatment needs special attention or a clinical decision from you. So most of the things that come up, the concierge will be able to respond directly to the patient with a preset decision tree of if you see this, then tell them this. Okay, so that you're only alerted to things that need you to bring the patient in or need you to make a decision. Concierge is going to check the notes from the patient so that they're being reviewed, any information or comments aren't being missed, and they'll forward anything to you that you need to make sure you see. Any slight or noticeable unseats that are still present need to be marked up and sent to the patient, so they will mark for you, where the patient needs to continue working with their aligner. Okay. But patients who get 3 no-goes in a row, so they've been working with your patient, trying to help them to use chewies, pointing out where they need to use the chewies, making them stay in the aligners longer. If they get 3 no-goes in a row, so they scan, it's a no-go, they get instructions from the concierge as to what to do, then they scan again, it's a no-go, they get more instructions, they scan again a 3rd time, and it's a no-go, then it's going to be escalated, and you'll be notified that you need to bring them in and figure out what needs to happen. If there's any lost attachments or lost buttons, that's going to be, you will be notified by the concierge. Or if there's any real noticeable hygiene problems, that will be escalated to you. The doctor will be able to force a force go. They'll be able to decide on a force go. So if you get the no-goes, you can say, okay, let's ignore that tooth. I'm going to just let that not track and let's go ahead and press on. Or you want to bring the patient in and make sure that there's space. Make sure that whatever, usually it's a space issue. If the tooth isn't moving, it's because there's a space issue. So you might need to go in there and lighten the contacts a little bit, or maybe revise the treatment. Okay, but they're bringing it to your attention, then you can decide how to move forward. So the dental practice is checking for inbox messaging from the concierge. The concierge is handling patients who aren't scanning, because that's one of the challenges is, patients may not scan. And so the concierge will be sending the reminders that you haven't scanned, your scan is late. If a new patient was never sent a scan and is 1 week late, the concierge will pause for the patient. We'll pause patient for a week plus a message to the patient and add the patient to the to-do list, and the practice will need to follow up with that patient. If the patient's more than 2 months late, the POS concierge will stop and add them to the to-do list for the patient, for the office to follow up. So basically, the concierge is managing the scan compliance from your patient until it gets to the point where you have to get involved as an office. Okay? If you have to refine a case, it'll be your job as a dental practice to notify the concierge through the messaging in the app that you're going to stop monitoring because you're going to do revision. That way they're not continuing to bug your patient that you have a scan that hasn't been done, you have a scan that hasn't been done, when really the patient knows that you told them not to do any more scans or change their aligners because you're going to be waiting for revision aligners. So you have to notify the concierge that you're doing a revision, and then again when you have delivered the new aligners and that you've started monitoring again so that they know that. The concierge will let you know when the patient's reached their last aligner so that you can bring them in and see if it's time to go ahead and move on to retainers or whether you need additional revisions. And when the patient is done with treatment, the concierge will leave that in your inbox as well. Patients with technical issues with the app will come to you directly, so they're not going to be, the concierge is not going to be supporting your patient if they're having a technical problem with the app. That'll bring that up to you, and then you can contact us here at Progressive to get support or directly through dental monitoring. So the things that your dental team will be responsible for is adding new patients and starting the monitoring with the app, checking and reviewing to see if there's any notifications left by the concierge, so checking your to-do list every day, leaving any special instructions or requests in the notes in the patient's file for the concierge to review. So if you want, say, notify me when they've gotten to aligner number 20, or notify me when the current arch wire has gone passive. Okay, so we can send our instructions to the concierge through the notes in the app via send instruction to the team. That's the part of the app we'll be communicating in. It'll be our job then to take any information that we get from the concierge and follow up with the patients, whatever needs to be done, whether it's non-compliance or whether there's some issue that has come up, a bracket's come off, a wire's broken, whatever's come up that we need to do, then that's our job, obviously, is to follow up on that. And then informing the concierge when we have done a refinement and they need to stop scanning, and then telling the concierge when we've stopped treatment and the patient is done. So that's just an overview of what's going to be done by the concierge service and what's going to be handled in your office by your team. I've included in our training resources, if you're interested, a couple of recent studies on using dental monitoring. Significant conclusions were that dental monitoring significantly reduced the number of in-office visits over the treatment duration, and achieving a clinically similar accuracy between the two groups in less time indicated an improved aligner tracking for the DM group. So fewer office visits, better aligner tracking was the outcome of this study. And there's another study that I included there that basically showed that the dental monitoring group also had significantly reduced number of appointments. So I'm really excited. We're happy to support you. If you're having any questions, concerns, or problems, feel free to reach out. But we just really are excited that you want to try this, and pretty convinced that once you do this on a few patients, you're going to find that this is just the way that you and your patients want to do ortho in the future. So thanks for listening, and feel free to reach out if you have any questions or problems.